Hello there. Are you, like so many health-conscious seniors, carefully choosing vitamins and supplements each day, believing you're doing the absolute best for your body? It's a commendable goal, truly. But did you know a hidden danger might be lurking right there in your medicine cabinet? It's a shocking statistic, but did you realize that over 24,000 people land in emergency rooms every year in the US because of supplement problems? Many of them are seniors, just like you, with the very best intentions. They thought they were boosting their health, staying strong, fighting off aging, but something went wrong. You see, the issue isn't always the supplements themselves, it's how they interact. Just like certain medications shouldn't be mixed, some vitamins and minerals can clash inside your body. Taking the wrong combinations together might actually cancel out the benefits you're hoping for. Worse yet, certain pairings can build up to dangerous levels, potentially leading to serious health issues. Think heart problems, nerve damage, even dangerous bleeding. Supplements aren't a one-size-fits-all solution, especially as our bodies change with age. Randomly mixing them, even with good intentions, can subtly undermine your health over time without you even realizing it. Are you accidentally making your body work harder or even putting yourself at risk? Today, we need to talk about this. We're going to uncover 7 potentially hazardous supplement combinations that many seniors take without a second thought. More importantly, we'll discuss the right way to use supplements safely so they actually help you stay vibrant and strong. Stick with me, because even things meant to be good for you can cause harm if you don't understand what's happening inside your body. Let's dive in. First up, let's talk about 2 vitamins many people take for energy and immunity: vitamin C and vitamin B12. Now, individually, these are powerhouses, especially for us seniors. Vitamin C? We know it's fantastic for the immune system, fighting inflammation, protecting our cells. And B12? Absolutely crucial for nerve health, making red blood cells, keeping our minds sharp. As we get older, absorbing B12 naturally can become harder, so supplementing often seems like the smart move. But here's the hidden catch. Taking high doses of vitamin C at the same time as your vitamin B12, especially first thing in the morning on an empty stomach, can actually prevent your body from properly absorbing that vital B12. Why does this happen? Well, think about vitamin C. It's quite acidic. When you take a large amount, that acidity can essentially degrade or neutralize the B12 right there in your digestive system before your body gets a chance to grab onto it. So that big glass of orange juice you're having with your morning B12 pill, thinking you're doing double duty for your health, it might actually be working against you. This might seem like a small thing, but over time, the consequences can be serious. B12 deficiency creeps up on you. At first, maybe you just feel a bit more tired than usual. You might notice some tingling or numbness in your hands or feet, have trouble concentrating, or experience those frustrating senior moments more often. You might chalk it up to just getting older, right? But it could be this hidden interaction stealing your B12. In severe cases, long-term B12 deficiency can lead to nerve damage that's difficult, sometimes impossible, to reverse. Isn't it frustrating? You could be diligently taking your supplements every day, thinking you're covered, but still end up deficient simply because of when you take them. So what's the simple solution? Thankfully, it's all about timing. Give these 2 vitamins some space. Wait at least 2 hours between taking vitamin C and vitamin B12. A good strategy? Maybe take your B12 with breakfast and then have your vitamin C supplement or that citrusy drink mid-morning or with lunch. This simple change can make a huge difference in how effectively your body absorbs and uses both nutrients. You get the benefits without the conflict. Remember, just because you can buy it over the counter doesn't mean you can mix it carelessly. Your body is a complex system. Let's help it work smarter. Next, let's look at copper and zinc. These two minerals often get talked about together, especially for immune health. And individually, they are important. Copper helps with energy, building collagen for skin and joints, and yes, immunity. Zinc is crucial for wound healing, hormone balance, and immune function too. It seems logical to take them together for a super boost, right? But here's where things get tricky. Zinc and copper compete for absorption in your gut, and zinc usually wins. Think of it like two people trying to get through the same narrow doorway. The stronger one pushes the other aside. Zinc is quite dominant in your digestive tract. If you're taking high doses of zinc, especially over a long period, like many seniors do during cold season, it can significantly block your body's ability to absorb copper. This can lead to a copper deficiency you might not even know you have. And what does that feel like? You might find yourself feeling unusually tired. Maybe you develop anemia that doesn't respond to iron, or perhaps you're just always feeling cold. Some people experience brittle bones or joint pain. Because copper is also involved in how your body uses iron, a deficiency can mess with your red blood cells too. The sneaky part? These symptoms are so easily mistaken for other things, or sadly, just dismissed as normal aging. But the root cause could be this mineral imbalance, triggered by taking too much zinc without considering copper. You take zinc to boost your immunity, but if it causes a copper deficiency, you could actually be weakening your body's defenses in the long run. It's a frustrating paradox. What's the smart approach here? Again, it comes down to balance and timing. Don't take high-dose zinc and copper supplements at the exact same time. Space them out by at least 2 hours. If you are taking higher doses of zinc regularly, maybe more than 40-50 milligrams daily, it's really wise to talk to your doctor or a nutritionist. Ask them if you should also be taking a small amount of copper to maintain balance. Sometimes alternating days works better. Be cautious with multivitamins containing both. The ratio might not be right for your individual needs, especially as our requirements change with age. Building strong immunity isn't just about what you take, but how you take it. Understanding this quiet competition between minerals helps you get the most out of both. Ask yourself, is my zinc supplement potentially creating another problem? Now, for a combination that involves a popular herbal remedy, ginkgo biloba and omega-3 fatty acids, like fish oil. Both of these are incredibly popular, and for good reason. Ginkgo is often used to boost brain circulation, help with memory, maybe even reduce dizziness. Omega-3s, they're superstars for fighting inflammation, protecting the heart, supporting vision and brain health. Taken correctly and individually, they offer real benefits, particularly for seniors. But here's the critical warning. Both ginkgo biloba and omega-3s can act as blood thinners. This means they reduce your blood's ability to clot. While that can be beneficial in some cases, like preventing certain types of stroke, combining two potent blood thinners without medical supervision significantly increases your risk of serious bleeding. Think about it. A minor bump could lead to a large bruise. A dental cleaning could result in excessive bleeding. If you needed even minor surgery, having blood that doesn't clot properly could turn into a major emergency. This is especially concerning for older adults who might already have more fragile blood vessels or take other medications that affect bleeding. People often feel a false sense of security because ginkgo and omega-3s are natural. But natural doesn't automatically mean risk-free, especially when combined or taken with other medications. So what's the absolute rule here? Do not combine ginkgo biloba and high-dose omega-3 supplements on your own. If you're considering taking both, you must discuss it with your doctor first. Be especially cautious if you're taking prescription blood thinners, like warfarin, Coumadin, Eliquis, Xarelto, etc., or even daily aspirin. Your doctor needs to know everything you're taking to assess the risk and monitor you appropriately. Your safety comes first. Don't gamble with blood thinners. Let's talk about the classic bone-building duo, magnesium and calcium. Everyone knows calcium is key for strong bones, right? We're told to take it to prevent osteoporosis. And magnesium? It's often overlooked, but it's vital too. It helps relax muscles, regulates nerve signals, manages blood sugar, keeps your heart rhythm steady. They sound like the perfect team. But here's the imbalance issue. Taking high amounts of calcium can interfere with your body's ability to absorb magnesium. They compete for uptake in your intestines, and calcium often muscles magnesium out of the way. So even if you're taking a magnesium supplement or eating magnesium-rich foods, if you're also taking large doses of calcium, especially at the same time, you might not be absorbing the magnesium effectively. What happens when magnesium levels get too low? Not because you aren't taking enough, but because calcium is blocking it. You might start experiencing muscle cramps, those awful Charlie horses at night, unexplained fatigue, maybe even muscle twitches or weakness. In more serious cases, low magnesium can contribute to heart rhythm problems, arrhythmias, and increase cardiovascular risks. The worrying part? These symptoms are often vague and insidious. You might blame them on stress, dehydration, or just getting older. Many seniors diligently take calcium for their bones, unaware that they might be simultaneously creating a magnesium deficiency that affects their muscles and heart. Calcium isn't the enemy here, it's the balance that's crucial. So how do you get both without causing problems? Aim for a good ratio. Many experts suggest a calcium to magnesium ratio of roughly 2.1 or even closer to 1.1. If you're taking 1,000 milliliters of calcium, you should aim for at least 400 and 500 milligrams of magnesium, possibly more depending on your needs. And timing matters. Take them at different times. For instance, take calcium with meals, often better tolerated that way, and magnesium perhaps at bedtime. It can have a relaxing effect. Check your multivitamin or bone health formulas. Are they balanced or heavily skewed towards calcium? Getting this balance right supports both your bones and your muscles and heart. Okay, let's tackle the fat-soluble vitamins, vitamins D, E, and K. These are all essential, especially as we age. Vitamin D for calcium absorption and bone strength, vitamin E as a powerful antioxidant protecting our cells, and vitamin K for blood clotting and directing calcium into our bones and out of our arteries. Since they're all fat-soluble, meaning they need fat to be absorbed, it seems logical to take them together, maybe with a meal, right? Not so fast. Here's the potential conflict. Taking high doses of vitamin D and vitamin E together might interfere with the absorption and utilization of vitamin K. They compete for the same absorption pathways in your body. If you're overloading your system with high-dose D and E supplements, you might inadvertently crowd out vitamin K. Why is this a concern? Well, poor vitamin K status can affect blood clotting, leading to easier bruising or bleeding. Perhaps more critically for long-term health, insufficient vitamin K means calcium might not get directed properly to your bones. Instead, it could end up depositing in your arteries, contributing to hardening of the arteries, arterial calcification, and increasing cardiovascular risk, the opposite of what you want. It also means your bones might not be getting the full benefit of the calcium you are absorbing thanks to vitamin D. This interaction is subtle. You wouldn't necessarily feel it happening day to day. You could be taking your supplements diligently, thinking you're covering all bases, while an unseen imbalance is potentially undermining your bone and heart health. So, what's the smart way to handle these essential fats? Timing and moderation. Don't take high-dose supplements of D, E, and K all at the exact same time. Spacing them out by a few hours can help reduce competition. For example, maybe vitamin D with breakfast, vitamin E with lunch, and vitamin K, if you supplement it, often found in specific bone formulas or K2 supplements, with dinner. And remember, always take these fat-soluble vitamins with a meal that contains some healthy fat, like avocado, olive oil, nuts, seeds, eggs, or fatty fish. The fat is crucial for absorption. Getting these details right helps ensure each vitamin can do its job effectively without hindering the others. Now, a combination often recommended but needs caution: vitamin C and iron. We often hear that vitamin C helps boost iron absorption, especially the type of iron found in plant foods and many supplements, non-heme iron. And this is true. For someone who is genuinely iron deficient, taking iron with a moderate amount of vitamin C can be very helpful for raising iron levels and fighting fatigue. But, and this is a big but, too much vitamin C taken with iron can lead to excessive iron absorption, potentially causing iron overload. While not everyone is susceptible, this is a significant risk for people with a genetic condition called hemochromatosis, where the body naturally absorbs too much iron. But even for others, consistently combining high-dose iron with high-dose vitamin C can push iron levels too high over time. Iron overload isn't harmless. Excess iron doesn't just get flushed out, it gets stored in your organs, primarily the liver, heart, and pancreas. Over time, this can lead to serious damage: liver disease, heart problems, diabetes, hormonal issues, and increased oxidative stress that can accelerate aging. The frightening part: symptoms often don't appear until significant damage has already occurred. You might feel fine for years, and then suddenly face serious health problems. So, how do you navigate this? First, don't supplement with iron unless you know you need it. Get your iron levels checked with a blood test. If you do need iron, taking it with a moderate amount of vitamin C, like 100 pound 250 mg, might be recommended by your doctor, but follow their guidance precisely. More is not better. Stick to recommended dosages. Be wary of taking high-dose iron and high-dose vitamin C together long-term unless specifically advised and monitored by a healthcare professional. If your diet is already rich in iron, red meat, poultry, fish, beans, spinach, you might not need supplemental iron at all. Check multivitamins too. Do they contain high amounts of both? Understand your needs before combining these potentially powerful partners. Our final risky pairing involves two minerals essential for daily function: calcium and iron. As we know, calcium is vital for bones, muscles, and nerves. Iron is critical for making red blood cells that carry oxygen. Without enough oxygen, we feel tired and weak. Both are incredibly important as we age. However, just like magnesium, iron absorption can be significantly blocked by calcium when taken at the same time. They compete in the gut, and calcium is often the winner. So if you take your iron supplement with a glass of milk, a calcium supplement, or even calcium-fortified orange juice or cereal, you might be preventing your body from absorbing much of that iron. What happens when your body consistently doesn't absorb enough iron even if you're taking a supplement? Persistent fatigue that sleep doesn't fix. Feeling breathless from simple activities. Cold hands and feet, pale skin, dizziness, weakness. These are classic signs of iron deficiency anemia, a condition common in seniors but often brushed off as just getting old. The culprit could be as simple as when you're taking your calcium and iron. This interaction is well known but easily overlooked. Many people take iron with breakfast, which might include dairy or fortified foods high in calcium, unknowingly hindering absorption. The solution is straightforward. Do not take calcium and iron supplements together. Give them space, at least 2 hours apart. For best absorption, iron is often recommended on an empty stomach, perhaps with a small amount of orange juice. For that vitamin C boost we discussed, used moderately. If that upsets your stomach, take it with a small, low-calcium meal. Take your calcium supplement with meals at a different time. This simple scheduling ensures both minerals get a fair chance to be absorbed and do their important work. Keep your bones strong and your energy levels up by avoiding this common nutrient clash. Okay, we've talked about the potential pitfalls, the hidden dangers. It might feel a bit overwhelming, but knowledge is power. The goal isn't to scare you away from supplements altogether, but to help you use them wisely and safely. And the good news is, just as some combinations can clash, others work beautifully together, enhancing each other's benefits. Let's briefly touch on a few smart combinations that can really support your health. Vitamin D and vitamin K2. We touched on K2 earlier. Taking D helps you absorb calcium, and K2 helps direct that calcium to your bones and away from arteries. A fantastic synergy for bone and heart health. Vitamin D and magnesium. Remember how calcium can block magnesium? Well, magnesium is actually needed to activate vitamin D in your body. Taking them together, though maybe not at the exact same millisecond, consider spacing slightly or taking mg at a different meal, helps ensure the vitamin D you take is actually usable, crucial for bones, immunity, and mood. Fat-soluble vitamins, A, D, E, K, plus healthy fats. We mentioned this, but it bears repeating. Always take these vitamins with a meal containing some fat: avocado, nuts, seeds, olive oil, eggs. The fat acts like a shuttle, carrying the vitamins into your system. Vitamin E and omega-3s. While we warned about high doses together due to blood thinning, moderate amounts can be a powerful anti-inflammatory team for heart and brain health. The key is moderation and doctor consultation if you're on other medications. So, beyond specific combinations, what are some common mistakes or hazardous habits seniors should avoid with supplements? 1. Taking everything at once. Don't just gulp down all your pills with breakfast. As we've seen, timing matters. Space them out based on potential interactions and whether they need food or an empty stomach. 2. Trusting generic multivitamins blindly. Convenience is nice, but check the label. Does it have balanced doses? Does it combine things that block each other, like high calcium and iron? Does it have unnecessary fillers? Choose reputable brands, or better yet, get personalized advice. 3. Not telling your doctor everything. This is critical. Your doctor needs a complete list of every supplement, vitamin, mineral, and herb you take. They can interact with prescriptions, affect medical conditions, or pose risks during surgery. Don't assume natural means doesn't matter. It absolutely matters. 4. Ignoring timing and food. Remember fat-soluble versus water-soluble, taking with food versus empty stomach, calcium versus iron timing. Pay attention to how and when you take each supplement for best results. 5. Thinking more is always better. Mega dosing. It's not. Too much vitamin A can cause problems. Excess B6 can lead to nerve issues. High levels of D can build up. Get levels tested if possible, and only supplement what you truly need in appropriate doses. Don't guess. Taking charge of your health as you age is wonderful. Supplements can play a helpful role, but only when used with awareness and understanding. It's about balance, timing, and knowing how these nutrients interact within your unique body. The smartest steps: be aware of these potential conflicts. Prioritize getting nutrients from whole foods whenever possible. Talk openly with your doctor or a knowledgeable pharmacist or dietitian about everything you take. Get levels tested periodically if recommended. Your health, your energy, your independence, they are precious. Making informed choices about supplements is one way to help protect them. Now, I'd love to hear from you. Did any of these combinations surprise you? Have you experienced any symptoms that might relate back to supplement timing or interactions? Share one thing you learned today that you plan to consider in your own routine. Let's support each other in this journey to healthy aging. If you found this information helpful, please give this video a thumbs up by clicking the like button. It really helps others find this important content. And if you haven't already, consider subscribing to our channel for more practical health insights tailored for vibrant living as a senior. Thank you so much for watching. Stay informed, stay proactive, and here's to your continued health and vitality.